So tell me a little bit, and you got your proposal before the council, and they approved it.
Yes.
So tell me what the bill would do.
It would eliminate simply the wait lists for all of the disability services for Mainers.
So take them off those sections you said?
Just provide funding, get those wait lists to zero. But also there is some language in it that requires the department to forecast ahead what they think future needs will be so that they can be prepared for those individuals and not allow a new wait list to be created as well.
How do you propose finding the funding to do all this? Sorry,
Yeah.
I was going to ask you that.
Yeah, well, you know, I think we're about to get a new revenue, a revision of Maine state revenue, and I'm hopeful that we've had a pretty productive economic cycle here in Maine, and that there may be some money available through that. But you raise a really good point. I mean, we in the state legislature are fighting for little kernels of money, pockets of money here and there, to fund very worthy projects and issues. And in my mind, this is a reflection of 4 sequential series of tax cuts that were put into place that I think in calculation in 2018 deprived the state of Maine of roughly $900 million. $900 million. And so I think we're starting to deal with that reality of there are consequences for giving tax cuts, especially to those on the upper level of our economic sphere, where we now have a situation where our elderly, our disabled, our mentally ill folks are not getting the services they want. And not only is that morally not acceptable, it's economically not acceptable, because if we don't provide those services, there's a lot of other more expensive ways that they are then going to be receiving our attention, and it's typically through the criminal justice system, and that's been shown to be a lot more expensive than keeping our families in their homes healthy and productive.
Home and community-based programs.
That's right.
We don't want to go back to institutionalized
That's
models,
right.
the commissioner had also pointed out.
Yep.
But again, we're talking about a workforce shortage, Rebecca.
Yep.
We're talking about the wages, are barely, again, the minimum wage is kicking in statewide, I guess, in
Right.
January. So that will be an onus on to the agencies that are trying to find these people as it is. How do you, try and address this issue? How do you address those issues that come with it?
Yeah, you can't do a scattershot approach, right? I mean, it's not a one issue problem that we're dealing with here. And again, so we're now being confronted with an and/or situation, perhaps, where, well, maybe we can only afford to pay the workers more, but we still can't afford to move people off of our disability lists. That's not the way to run these programs. I mean, they're hand in hand. So I do hope at some point we're going to talk about how we have literally starved our state from being able to fund our nursing homes, our services for our aging, our disability community, our mental health community. It's time.
It's great news especially for these families. We're looking at, 1,900 on waiting lists right now. Again, it's not something you could provide them with a magic bullet. It's going to take time, but at least
That's
having
right.
that mandate maybe to move everybody off, finding the funding, the workforce issues hopefully will follow, right?
Right.
And again, it sounds like the department is obviously a willing partner in this, looking for that network of beds they want to establish, that, the mental health issue is huge, and that they can find those beds. Commissioner Lambro believes there are beds in our system, even though everybody says there's no beds in our state. They're being sent out of state. She says she says the beds are there. Do you believe that as well? That they could find those extra?
If that's what the commissioner has found, I'm not going to question it. But the question for me is how many beds, and are they sufficient? And I believe we just read about one of the providers is closing up its services across the state of Maine because they cannot function at the pay scale or the reimbursement rate that we're offering them. That is going completely in the wrong direction. So that was a terrible bellwether for me. So maybe there are beds, but we're not necessarily looking for all beds either. We're looking for service providers, like you said, in-home and community providers.
I understand the state of Maine can set its own reimbursement rate. Is that something you're looking at as well, to be part of this?
I believe that there is another bill, Representative Craven introduced last session, that has been carried over, that addresses that issues. Ideally, we fund both. Yeah.
And then if that's something that could be hopefully raised somewhat, that could attract more people and
Yeah.
more providers,
Yeah.
and they're closing for that reason.
Yeah, I just came from an event where we were talking about apprenticeships. Companies are just struggling to find people to fill their jobs. And in the care industry, that's a really hard job. That takes its toll. In of itself, it's hard to recruit and retain individuals in that area. And then when you add on top of that low pay, it's no wonder we can't find people. And folks who are offering really high levels of salary, doing jobs that are not nearly as emotionally strenuous, aren't able to fill their jobs either. So we just have this tsunami of workforce issues and pay issues.
And you don't want to pick and choose. It shouldn't be like
Right.
that, right? What
That's
can you
right.
tell the families that will be watching this? It's going to be embedded in our online story, that are really looking for some kind of hope in the future after waiting. We have heard reports of years of
Yeah.
these families waiting, right?
Yeah.
You've heard that too.
I have. I am so encouraged by our administration and DHHS and the commissioner and the seriousness with which they take this issue. And so I do believe that we have an agreement that this has to be addressed. And the question then is just, can we address it quickly enough? Can we start some forward momentum in time to provide relief for these families and their children?